And we're going to just give a few minutes of time to joining us here at SAMHSA's Office of Recovery webinar series for Recovery Month. Today, we're talking about get together and get talking about recovery with the Opioid Response Network. And our webinar series is to educate and provide key discussions in many recovery spaces. Each week, we are highlighting a theme for the week. This week, our focus is on the recovery dimensions of purpose. This week, we look at the importance of purpose as a motivator for positive change and how it can help the recovery process of people with mental health conditions and substance use disorders. Purpose means different things to different people. We're defining purpose as conducting meaningful daily activities such as going to work, school, participating in volunteer activities, family caregiving, or creating endeavors, and having the independence, income, and resources to participate in society. Everyone can find purpose in their lives through a career, creativity, or spirituality, and in daily activities that help people stay focused and feeling positive. Next week, our theme will be community, so feel free to join us next week as well. Here at SAMHSA, we're celebrating Recovery Month, which is a national observance held every September to promote awareness of the power of recovery from mental health and substance use conditions. It celebrates the millions of Americans in recovery and recognizes the contributions and accomplishments of people in recovery, their loved ones, and allies. Recovery events are celebrated around the nation and around the world. Recovery Month is intended to counter stigma and instill hope in the American public that recovery is possible. Today, I will introduce myself. My name is Michael Askew, and I have the honor of serving as the Deputy Director in the Office of Recovery. I also am a person in lived experience, as well as a person that was formerly incarcerated. Today, I will have my public health advisor, Julie Erickson, assist me with the IT piece here. The Office of Recovery is charged with advancing recovery across the nation in partnership with people like you, with lived experience, others with family members, and communities impacted by mental health and substance use conditions. Our office has two major events this month: our Walk for Recovery, which was celebrated on September 5th at the nation's capital. And as we look for next Tuesday, our Star Awards and the Gallery of Hope display will happen, which will be live streamed. We also will be releasing fact sheets throughout the month as well. And we thank you for your attendance and support during Recovery Month and throughout the year. Today, we have a great lineup of individuals to speak about recovery. And so without further ado, I'd like to present to you Ms. Catherine Cates-Weasel, American Academy of Addiction Psychiatry. Catherine, it's over to you.
Thank you so much, Michael. We are thrilled to be here, and on behalf of the American Academy of Addiction Psychiatry and the Opioid Response Network. This is a perfect timing, and we were so fortunate to be included, but also in the theme of this week. This really echoes the mission of the Opioid Response Network. We want to give you a little bit of information about it, and we brought two of our champions that are going to give examples of two of the projects and organizations that we support through the Opioid Response Network. Keep in mind throughout everything that we do, it's free of charge, and it's meant to be for you. It's supposed to be locally driven, and it's to meet your needs. So this isn't us pushing our agenda onto you. This is about helping you meet your mission and your efforts. So keep in mind, this is all about you. Next slide. Just to reiterate, this is a funding by SAMHSA, and the thoughts and opinions reflected are not in any way the official views and policies of the U.S. government. This is a SAMHSA-funded initiative, and we're very grateful. Next slide. So the Opioid Response Network is a large coalition. The American Academy of Addiction Psychiatry is the recipient of the award, but we work really closely with a large group of other organizations. We're in partnership with the University of Kansas, Missouri, the Addiction Technology Transfer Center Network, and the Columbia University Division on Substance Use Disorder, but also a very large and diverse national coalition across prevention, treatment, recovery, harm reduction, and beyond. Next slide. I won't go over all the organizations, but we have over 50 organizations now. And I feel very strongly about coalitions and collaborating, because I think that's the only way we're going to make real change. We have to understand each other's perspectives, backgrounds, lived experience, barriers, but also strengths. And so that brings not only the usual stakeholders, but we've also brought in legal law. We've brought in various underrepresented communities. And we want to have a voice for everyone. And I think that's the only way we're going to make real change. So hopefully you can go to the website and see this large coalition where we all work collectively together. And we all have to agree to sign to guiding principles. So we're all on the same page and understanding. We're just not going out and doing our independent things without having acknowledgement of what our purpose is. ORN is a free resource. Everything is free. So it's training and education, also consultation, a lot of work around implementation, because that's where we see a lot of the hiccups in getting things happening. Okay, it's great to be trained, but what happens when you try to put it into practice? What are all the challenges that you have? So we have implementation scientists. So we provide evidence-based when possible, training, education, as we said, across the spectrum. And it's from local consultants. Next slide. So our goal is to streamline efforts. I've been in the field for over 40 years. It's hard to come by these funds. And so we don't want to waste resources. We don't want to compete with each other or others. We don't want to ignore this. You folks are doing wonderful, powerful things out in the community. We don't want to compete with that or ignore. We want to identify, I call it connecting the dots, identify who's doing what, and look for places where there are gaps of things that aren't happening. And how can we go in to help support, meet those needs? Next slide. So every state and territory in the United States has a designated technology transfer specialist, which we call, yes, we have acronyms galore, like always, the TTSs. They facilitate, oversee, and they're your support system at the local level. We want people to understand what's going on in your community, not me in Rhode Island coming into Mississippi to try to tell you, I know what your life is like and what you are challenged with, but what your strengths are, but somebody that's local, somebody who's been in your community, that knows the people, knows what's going on, and can really relate to what your needs are. That person is your point person. So whenever anyone puts in a TA request within one business day, that person will schedule time to meet with you to talk about what your needs are, what is locally important, and how to customize those needs to meet your specific request. Next slide. So who do we do it for? It gets very confusing, and there's a lot of TA programs out there, and they all bring wonderful things. What's unique about us? So what's unique about us is we provide training for everybody. We have government agencies, all sizes. We have organizations, nonprofit, for-profit, treatment programs, communities, individuals. One of the first people we got a request from was from a grandmother in Rhode Island wanting to know about how to get resources to educate her and her family for taking custody of her grandchildren whose parents were incarcerated for substance use. And so we helped connect her with training materials and support systems. And now she and others have set up a 501c3 support group for families in similar situations. So anybody that has a question about training and education and learning, we're here to help. Next slide. I'm going to give you a couple examples just because people get a little bit overwhelmed. They go, well, I don't really know where to start. And that's not uncommon. That's really the most common thing. So when the technology specialist meets with you, if you put a request in, don't feel uncomfortable by saying, I'm really not even sure where to begin, because it's overwhelming. More times than not, they have to sit down and walk through the things. And sometimes having an implementation scientist to help you sit and prioritize things, to think about how do I even begin to start, is really very helpful. And the technology specialists are key for that, because they can help you figure that out. So prevention, we've done some things like training family members about the use of naloxone, how to create a prevention curriculum. We can't create the curriculum for you, but we can give advice. We can direct you towards evidence-based curriculum, and other materials, give you feedback on things that you might have created, creating community awareness and anti-stigma campaigns. Stigma is probably one of, as you imagine, one of the biggest requested areas of training. Consistently, it doesn't matter which area it comes from, stigma, stigma, stigma. So we have a lot of resources around that. Next slide. Treatment. How to develop telehealth services to expand treatment, guidance on the use of medications, screening for suicide and self-harm, the use of all of the approved medications. That's probably one of the more popular ones too. How long should a person be on a medication? How do you know which medication to be on? So we have experts throughout the country who are available that can be provided to do trainings, but we really want to use local people with experience and those with experts too, but also people that have experience. You don't have to be an addiction psychiatrist like my members, but people that have experience and have been treating in this area as well. Excuse me. So these are just examples. These are not by any means meaning this is what we're limited to. It's just to give you a sampling. Next slide, please. Recovery. So this is right down your sweet spot, educating staff in the use of medications and the role in recovery, how to expand recovery in rural areas, step-by-step process for creating peer recovery services, training for recovery coach models. Another one is how do we get the recovery community and the treatment community working more collaboratively? What do we need to understand and know about each other? Also interdisciplinary training. That's another big area that I know from my field, my organization is we're working really hard. It's how to, and that's one of our discussions today on our steering committee for the provider's clinical support system for MOUD, which I also run, is how to work more collaboratively with the recovery community. I think that's really important, and we have to be able to come out of our usual conversations and discussions and talk with others in the field and not just stay in our own area. Next slide, please. Harm reduction, finally, practicing building community-centered support, education on fentanyl test stripping and drug checking, trauma-informed practices, guidance on developing syringe exchange programs. Next slide. And I'd be remiss if I didn't talk about addressing health disparities. That's another huge area that we're really trying to focus on quite in depth because we all know it's terribly needed. And so that's a big push and a priority for us as well to integrate throughout all of our work. So how does it work? So go to opioidresponsenetwork.org. We can put it in the chat. Click the link and at the top corner, it'll say request a training. So it might take a minute to do that. Click it, and it's really simple. You put in your name and your organization. It takes you 3 minutes. It will go automatically to your technology specialist in your community. Within 1 business day, yes, 1 business day, that person will get back to you in an email and say, let's set up a time to talk. I use the analogy of a temporary agency. And so they're going to ask you some basic questions. Who's your target audience? What are your goals? Tell me what you've done in the past, so forth and so on. And then from that, we have vetted consultants across the spectrum of all areas in your community or close by to be available. It's like a temporary agency. So the technology specialist matches you up with the best consultant. Our job is to pay for that consultant. Our job can mean traveling that person to you or meeting with you on the phone or Zoom or face-to-face, but that's our responsibility. We pay for all of that. You do not. And then the technology specialist stays involved to make sure you're getting what you're needing, making sure that the trainer understands, making sure it all works, and to follow up and get the data to see if it's effective. So they're really meant to be your resource to help you, as well as the consultant. Again, we have people across the spectrum, people with lived experience. We have addiction specialists. We have counselors, therapists, preventionists, in every state and territory in the entire country. Next slide. So we have a quick video that we're going to share just to give you an overview, and then we'll share some of the work of 2 of our partners.
Opioid and stimulant use. Communities across the nation are mobilizing to address opioid and stimulant use and the overdose crisis. You can't overcome this alone, but we can, together, and we are. We are the Opioid Response Network, a coalition of 40 national organizations representing more than 2 million people. We serve all 50 states and 9 territories locally through our network of nearly 1,000 professionals working across prevention, treatment, and recovery. For state agencies, organizations big and small, and individuals working to address local needs, we bring training and education to bear on your efforts. We're here to help you help others through evidence-based support, all at no cost to you. For instance, the Opioid Response Network helped the Tribal College in New Mexico join forces with local organizations to develop a culturally appropriate prevention, treatment, and recovery training series for its students. In Rhode Island, we convened correction staff from 34 states to share how our program had reduced post-incarceration overdose deaths by more than 60% and supported them in their efforts to build similar programs in their home states. In West Virginia, we mobilized to help a clinic incorporate substance use disorder services into their practice, serving a faith-based community. We helped healthcare providers in South Dakota address barriers they face providing treatment services for their patients. We're here to help those on the front lines. So, what are your needs and how can we help? Visit the opioidresponsenetwork.org to learn more and to submit a request for support. The Opioid Response Network, funded by the Substance Abuse and Mental Health Services Administration.
So hopefully that gave you a general idea of who we are and what we do. I did forget to mention, and I apologize, we also not only working for everyone and anyone, generally it was started to fund, to help support SOAR grantees and TOR grantees, Tribal Opioid Response. So we do have a small focus team on working with tribal needs. So I just want you to know that we also have other, we have a panel of diverse across Black communities, Indigenous communities, sexual gender diversity, Latin communities, and so forth. So I just want to make sure people know that we are very sensitive to the needs of underrepresented and under-resourced communities, and we do have a cadre of experts in those areas that are overseeing working with us. So I'm going to turn this over to one of our superstars. We have many, and we're fortunate to have 2 today. So Ryan, if you could talk to us about what you're doing with funding from the Opioid Response Network, in addition to your other support.
Great. Thank you for welcoming me and being here. It's good to look I just took a glance at the participants and saw a lot of familiar names. I'm Ryan Hampton. I'm the founder and the executive director of Mobilize Recovery. I'm also a person in long-term recovery, which means I haven't felt it necessary to have a drink or a drug or a mood or mind-altering substance since February 2nd, 2015. And happy Recovery Month. I'm always so grateful when we get to September. It's a time for us to celebrate recovery communities, celebrate the work that's been done in this movement, celebrate the innovations, the resilience, the value that recovery brings to our communities. I'm just so grateful for all of you, everybody who is on this call, for the work that you do every single day, for Phil, who gets to present after me, for Catherine, for our partners at SAMHSA. Just thank you so much. Sometimes I, in days, throughout the year, wake up and wonder if the work's really working. This is not easy work, I think, for any of us. But in September, I'm reminded time and again, and being able to get out into communities, and I'm going to talk about that in a second, that the work is working, even though sometimes we may not be able to see it right in front of our face. There are phenomenal things happening in communities across the US, specific to recovery and ending overdose, and I am profoundly grateful to be a part of this movement. So what is Mobilize Recovery? As you can see here on our slide, our mission statement is: we are dedicated to raising up the voices of people whose lives are affected by addiction and overdose. We are from direct outreach to civic and community engagement. We strive to empower advocates to take direct action by providing digital tools, advocacy training, education, and peer learning. Our website, if you'd like to learn more after this, is mobilizerecovery.org. We're at our core, we're a national nonprofit organization with a hyper local focus, dedicated to ending the overdose crisis in our communities. We were founded in 2019 on the belief that recovery is possible for every single human being. And we are committed to providing resources, education, support to individuals, families, and communities who are affected by substance use disorders. We started in 2019 as an idea. It was really a convening, and some of you, I can see your names in the participants were actually there. We brought together 150 advocates from all 50 states, and we spent 3 days in Las Vegas, Nevada, with these advocates, talking about what is it that their communities need, what are the gaps, where do we really see folks and organizations falling through the cracks, and how could we as advocates, folks with lived experience, lean into those problems and help to be problem solvers, and provide solutions. And really what we found coming out of that initial meeting was we needed more peer learning, and we needed more support on the ground, and we needed to be coming from folks with lived experience. And we have built that idea up since 2019 into something really special. Our goal is always to be building more leaders. If we're not building more leaders and better leaders in the recovery space, then we're not doing our job. We have a few key focus areas, being peer support and peer learning, facilitating the development of peer-led recovery communities, emphasizing the power of lived experience and supporting long-term recovery. Another key focus area is harm reduction, providing access to naloxone and overdose prevention training. At the Mobilized Recovery, we do have an overdose response program where we're partnered with Direct Relief International and the Clinton Foundation. And we also advocate for policies that prioritize public health and safety. Through our overdose response program, though, to go back to that for a second, we started that right before the pandemic in 2019, and had received a donation of 1 million doses of IM naloxone. And we have been able to deploy over 922,000 of those doses in 24 states, just through our peer-led network with Mobilized Recovery. And I'm really proud of it. And our organization is really proud of it. Another key focus area for us is stigma reduction and bold media. We have long since 2020 actually launched public awareness campaigns to challenge misconceptions about addiction, recovery, and overdose. We educate healthcare professionals, policymakers, and the general public about the science of addiction and the importance of compassionate care. And we strive to create safe and inclusive spaces for individuals in recovery to share their stories and to find support. And then lastly, our other main focus area is advocacy. We work with lawmakers and policymakers at the local, state, and federal levels to advance policies that support recovery, overdose prevention, and harm reduction. And we mobilize our grassroots advocacy efforts to amplify the voices of folks with lived experience in recovery and their allies. We build robust coalitions with other organizations. Partnership is a big deal for Mobilized Recovery. We would not be here today if it wasn't for the strength and support of our strong partners to fight against the overdose crisis. Next slide. So next slide. I went a little ahead of myself. There we go. So we have some key initiatives at Mobilized Recovery, going back to our stigma reduction and public awareness and bold media efforts that really tie into building our advocacy base, that tie into our trainings, that tie into our advocacy, that tie into us recruiting new folks to be a part of this movement. And one of those initiatives that we're about to launch, and as soon as I get off this call, I'll be back to planning phase on Friday, is the Mobilized Recovery Across America bus tour. We did this in 2021 with great success. We actually were able to have interactions in 2021 with over 12,000 folks who attended our events and participated in trainings. The goal of this really is that we travel across the country, to raise awareness about addiction, solutions to the addiction crisis, and overdose crisis, and to connect people with local resources in their communities. We offer naloxone training, we offer peer support, we offer educational training and events in communities nationwide. We partner with local organizations, and our goal is really to amp it. Our goal is to, yes, there's a spotlight on this big, huge bus that's going around the country, which helps to draw attention. But it's really to put the spotlight on the local organizations and to amplify their impact and to bring more people into the fold, into what they're doing, and to build sustainable recovery ecosystems. As you can see, this is a very ambitious tour schedule for 2024. When we originally came up with this thought, the team said, no more than 12 events. And I said, yes, that's fine. We're going to keep it scaled down this year, no more than 12 events. And we have ended up with 37 events collectively in all of these cities. We launch on Friday in Los Angeles, California. And then we will be going to Rancho Mirage, California, Phoenix, Arizona, Las Vegas, Nevada, Salt Lake City, Utah, Castle Rock, Colorado, Denver, Colorado, Cedar Rapids, Iowa, Indianapolis, Xenia, Ohio, Dayton, Ohio, Oak Ridge, Tennessee, Myrtle Beach, South Carolina, Richmond, Virginia, Washington, D.C., Maryland, and Springfield, Virginia. In each of these cities, we will be in them, some of them a full day, some of them a day and a half. It will be a mix between bold media events. It will be a mix between trainings. It will be a mix between coalition building. Each city is a little unique. If you see any city that you are close to and you would like to be a part of it, it is never too late to be involved. And thank you. And we'll see you in Indy too. I see the note on the chat. Please just go to mobilizerecovery.org. The schedule is there. The sign up is there for each city. And we also have a contact on there in case you're looking to possibly partner on some of these events. We also offer year round, because while our big splash tends to happen in the months of September and October, we do training and resource support all year round. We provide a comprehensive online training platform with information about addiction recovery advocacy, resources, treatment, recovery support services, and harm reduction. We offer several monthly virtual and in-person peer support group and mutual support group meetups for our advocates around the country, and also peer learning opportunities and training opportunities for them. And, we connect individuals with local organizations on the ground. A lot of the feedback that we have gotten over the years from our advocates has been that one of the biggest barriers is that they're doing great work in their communities, but they don't necessarily feel connected to many of the resources that may be on the ground. And we try to close that gap for the other, 10 months of the year. I'd be remiss if I didn't mention, our impact. Since we really got rolling, which was right in the middle of COVID, we have trained over 18,000 individuals in this community on overdose prevention, response, and community-based advocacy and recovery advocacy. We've distributed, as I mentioned, the nearly 1 million doses of naloxone. We have, through many of our mutual support networks, helped countless individuals actually find direct services to help sustain their long-term recovery and path to wellness. And I believe that, this movement, and when I say this movement, it's the folks in this movement. It's not me, it's not our leadership. It's really the people who bring Mobilized Recovery and the organizations that bring Mobilized Recovery to life have played a pretty critical role in shifting, the national conversation and perception around addiction and recovery. We've had tens of millions of media impressions. We, are grateful to have been able to partner with organizations such as ORN and SAMHSA and Google and iHeart. We each year we've been at the forefront on a public awareness effort PSA campaign on all iHeart radio stations that is currently running right now every month for the month of September, that reaches millions of people and provides them not just with direct service support, but also ways to get involved with local organizations. We've always felt, one of our guiding principles was that we didn't want our efforts to be speaking in an echo chamber to just the recovery movement and the recovery space. We wanted to be there to lift up the recovery space and find these unique and creative ways to lift them up, but then to create a message and a story to invite others in, whether they be businesses, nonprofits, organizations, and individuals in hometowns, to really make this attractive, to bring in allies from outside the recovery space and have them join our efforts. Next slide, please. So another key vertical for Mobilize Recovery is our Mobilize Recovery Day of Service. This was actually started last year for the first time. We wanted to figure out a way for folks who weren't necessarily able to attend, a Mobilize Recovery event through the bus tour, where you saw we're limited in resources and time. To, if it was up to us, we'd be in every city across the country and be on the road all year long, but we're unable to do that. So we wanted to create a space where anybody could have a Mobilize Recovery experience in their community, but also to show the value of recovery in communities by inviting, folks from outside the recovery community to be a part of one of the key principles of what I believe exists in the recovery movement, which is being of service to your community. The Mobilize Recovery Day of Service, it's a nationwide event where communities come together to take action. Days are dedicated to service, they're dedicated to compassion, they're dedicated to empowering individuals and communities affected by this crisis. It's an opportunity, to raise awareness, to provide resources, and to really make a tangible difference in some of the larger issues that are facing local communities. But it also, was to me really special because it gave away an opportunity. It made way for an opportunity for folks in recovery to interact with others in their community that they may not otherwise interact with. Our core values and goals around this particular vertical, is really mobilizing volunteers to engage in meaningful service projects that address the needs of the people in their communities. These examples of projects are naloxone distribution and training events, their community cleanup initiatives, their fostering, their dog fostering opportunities with animal shelters. Some of them are organizing resource fairs to connect individuals with recovery supports and other essential services. Some of them are packing hygiene kits that can be distributed within their communities. And it's about, fostering a culture of empathy and understanding, right? Between folks in communities and folks in recovery. It's about breaking down stigmas and discrimination that are associated and have long been associated with our community. I am grateful. I actually get to report this on the call today. We've had over 600 Day of Service events signed up for the Mobilize Recovery Day of Service. It's not one specific day. It goes on for the entire month of September and October, and each community gets to decide what their day of service is. But to be able to pull off 600 Day of Service events, in celebration of this community, but also to show the value of recovery in our communities is quite amazing, and something I'm just really grateful that our community has stepped up to make happen. So with that, I know I'm running out of time. I'll just leave you with the call to action. There's a way for everybody to be involved, for the Mobilize Recovery Day of Service, participate. It's at recoverydayofservice.org. Sign up for an event or attend an event in your community. Find a local Day of Service event. And if you don't have one in your community, create one. Spread the word about our activities. Reach out to us to be a partner. Join us on the bus tour. For many of you, if you have training and education opportunities, we would love to bring those into the Mobilize recovery community. And within our platform of opportunities that we offer to advocates, I'm a big believer that we're stronger together. And there is no pride of authorship over any of this. We want to share as much information as possible to be able to help folks. So with that, I just want to thank you all for your work. Again, wish you a happy recovery month. Hope to see many of you over the course of the next several weeks where we can. And I guess I am now passing it off to my good friend, Phil Rutherford with National Council for Mental Wellbeing.
Hello, hello, and thanks for that, Ryan. I want to start. I don't know about your math. You said 12 cities, but I counted 18, so I'm not sure. Not sure
So
if you
yeah,
got that.
it's not right. It was well, I was supposed to be 12 cities. It turned into 18 cities with 36 events between all 18 cities. And
Okay.
I think my team is ready to fire me over this one. But we are gonna trudge through because that's what we do.
Perfect. Perfect. Hello, everyone. It's good to see. I see some familiar names on the call as well. My name is Philip Rutherford. Ryan introduced me from my day job, which is the National Council for Mental Wellbeing, and but I'm here today representing another organization. It's an organization I founded back in 2020 named Black Faces, Black Voices, and we'll get into a little bit of that. But first and foremost, Black Faces, Black Voices is a collaborative of professionals focused on promoting recovery and wellness in Black communities. And what that really means is that we're a collection of people, kind of like myself, in that many of us have jobs at other organizations, and we're connected with the recovery and mental health space. But we found, and those of us that started the organization found that we really weren't seeing the kind of change and positive change that we wanted to see specifically in Black communities. So we started with the idea that, hey, maybe there's a way we can help work on health equity. I'm also a person in long-term recovery, and you'll notice that I'm talking about health equity, but in a lot of Black communities, really the path to recovery includes health equity, and I guess it's that in most communities. But if there are great deficiencies in a healthcare system, it's a lot harder to work your way towards recovery. So our focus is health equity, and I want to just a couple of things that we work on. I'm here to talk mostly about the Unity Dinner Focus Group project that we're working on with the Opioid Response Network. But in general, we do a few different things. Most recently, we just published a paper on Black women transiting the criminal legal system and I think that paper covered 5 different states: New York, Pennsylvania, Michigan, Georgia, and Texas. And that was a partnership with Community Catalyst in Pecori. And we're also we're currently working on another paper around the importance of telehealth. And that's a bigger grouping. That's the Appalachian states, so 13 states, and what telehealth looks like in Black communities. So we do research stuff. We do community level projects, state level projects. And really, it's about trying to see if we can address barriers in health equity. So, unfortunately, I'm going to start with some sobering news, and again, by seeing the people on the call, I know that many of you know this. But next slide, please. Okay. So, because I know some of the people on the call, some of you have seen this information. If you're unaware, and this is particularly timely because CDC just came out with some new data today. And the reason this data lags so far behind is that it takes time to verify deaths and understand deaths. But the short version of what this chart means is that in Black communities, the overdose death rate is proportionally higher and higher at a statistically significant level. So one of the things that we've been doing most recently is working on something called Unity Dinners, and I'll tell you all about them in just a moment. But this chart is particularly important because it shows the increase. It shows what is happening over time in Black communities around overdose death. And that's particularly challenging. It's one of the reasons that I started by talking about health equity, because it's not just about naloxone and the other FDA-approved medications. There are some other challenges in the healthcare system that we think are impacting overdose. Next slide, please. Another component of this is the impact of fentanyl into the drug supply, into the illicit drug supply. And this last chart is particularly the fourth wave here is particularly interesting to us, and that is the rise of fentanyl contaminating the stimulant supply. And again, we are seeing this rapid increase in terms of Black overdose death. If you're not familiar with this chart, wave one is the sort of the beginning. And by the way, there have been multiple opioid crises in America. I don't have time to go through all the rest of them, but Google it. This isn't the first time. But this particular iteration of opioid crisis started with prescription opioids. That's wave one. Wave two is heroin. Wave three is fentanyl. And what some are calling wave four is the complete this is the presence of fentanyl just about in every illicit drug supply. Next slide, please. So unity dinners. This came out of so there are all sorts of groups that have dinners, and there are all sorts of purposes for dinners. But this particular style of dinner came out of some conversations that we were having around problem solving. And when I was a kid and there was a problem in the family, what we did was my mom or my dad got us in the car and we went to grandma's house. And that's where we sat down, had a meal, talked it out, hugged it out, sometimes yelled it out, whatever it was. We did a thing to get everyone around the table, have a meal, and figure out what we needed to do. So the concept of unity dinners is basically it's based on that. And it's really it is a little bit prescriptive in that when we put together a unity dinner, we have 5 or 6 different we call them personas, but what they really are positions in the community. So we make sure to have faith leaders at the table. We make sure to have people from the harm reduction community at the table. We make sure to have people from the recovery community at the table. We make sure to have just sort of general community folk at the table. And what we want to do is have a conversation around what people are seeing, and specifically around stigma. In fact, one of the promos for what we do says break bread, break stigma, because due to some of the impacts of what happened in the 80s and 90s during the cocaine epidemic in Black communities, is that the level of stigma, specifically inside the Black community, is pretty high. So, and again, it's a very complex, stigma is a complex thing, but because of some of the over policing, hyper criminalization, mass incarceration, because of some of the impacts of drug law over the years, the idea of saying, hey, my kid's got a heroin problem or my kid's got a fentanyl problem, and that's why he broke into your house and stole your TV. That's not a conversation that a lot of people are willing to have. So we really are trying, with unity dinners, we're trying to normalize the discussion around substance use disorder, make sure that people understand that there are resources within the community for help, and then obviously talk about some of the life-saving methods that exist out there. Next slide, please. So, like I said, these are community-focused dinners, and we want when I said it's prescriptive in terms of who we invite. It is in no way prescriptive of what the solutions are, and it's kind of interesting because it is sort of the polar opposite of my day job at National Council. At National Council, my title there is Strategy Lead for Substance Use. I look at kind of what are the national trends for substance use writ large, and how do we advance substance use policy in the country forward. This is the polar opposite of that. This is, we're sitting around a table, we're in, and I noticed that I'll give a shout out to my friend Bobby Bledsoe from Louisville. She's a Black Faces, Black Voices member. But we're sitting around a table in Louisville talking about what we can do in a small town in rural Kentucky to stop people from dying, right? Like where can we put naloxone in a box somewhere so that people can get to it? So these are very interesting conversations that come up, and what we're doing with ORN is actually focus grouping those conversations. So the initial batch of unity dinners that we did, and big shout out to the African American TTC down at Morehouse, Dawn Tyus. I don't know if you're on the call, Dawn, but thank you for helping out with that. In the focus groups, though, we're having a chance to sit down and debrief these conversations even further. And one of the reasons I mentioned Louisville is that shortly after the Unity dinner, that group was already planning the next Unity dinner and the next event to sort of attack these problems locally. At that dinner, we had representatives from the Kentucky Office of Attorney General who are connected with the opioid settlement fund. So like sometimes we can make these kind of community level connections that really show impact later on down the road. And I referenced the CDC numbers that came out, and just I wasn't trying to create anticipation, but the deal is the numbers they reported today, and they're provisional. So these are always provisional. It takes about 18 to 24 months to get real solid numbers. But the numbers that came out today were saying that there was a 10% decrease, which is a wonderful thing. I celebrate that. That means that more than 10,000 or more than 10,000 people didn't die, right? And that is absolutely wonderful. That is a testament to some of the methodologies that we're using. It's probably a testament to naloxone. It means we're pumping naloxone. It means that we're getting information out there. It means that that recovery works. It's real. We know that is happening. And in a lot of the states, and we have data on about 20 states, provisional data on about 20 states. Unfortunately, while the overall number has gone down, the number in Black communities still continues to go up. And so that does a couple of things for me. Number one, it's kind of like a mixed bag, right? Like, so I'm happy that fewer people are dying. I'm crushed that we're not getting through in Black communities. And I believe that to be largely about this health equity issue. If you think about kind of the early days of COVID, and Black communities, this is pre-vaccine, but Black communities were sort of experiencing the brunt of death on that. It's a similar thing. The absence of infrastructure around healthcare contributes to a greater likelihood of death. So Black Faces, Black Voices, we don't want that. We want all communities to prosper. And one last thing on this, because I know sometimes people are sort of taken aback by the very direct way that I'm talking about Black community this, Black community that. At Black Faces, Black Voices, we reject the notion of a zero-sum game. We don't believe that in order for one community to do better, another has to do worse. That's not it. Those of you that have been working in the recovery space for a while know that we don't suffer from a lack of resources in this country. We suffer from a lack of political will. And the challenge that we have as a society is, where are we going to put our resources, and how are we going to make sure that the most vulnerable and the most underserved in our society are going to get the things that they need. And so that's where we're coming from. We want everybody to do well. Anyway, I feel like I'm preaching, so I'll step down off the pulpit and hand it back to Catherine.
Thank you, Phil, and thank you, Ryan. See, we have great superstars, and it just underscores having purpose. And I think just to highlight that we can't always go back to the standard way of doing things. And so that's why local, personal is really key to what ORN is here to do to help you. And so, like having Phil and Black Faces and Black Voices and Ryan going out and explaining and helping us learn how to reach out to other communities, that's really critical. So we need to be here to work together with you, hand in hand, in all directions. So thank you so much. Put a TA request in so I can know you heard us and you know about us. Share it. And Mike, I'm going to turn it back to you.
Well, thank you, Catherine. Thank you for the strong, rich conversations, Ryan and Phil, my two friends in recovery. And certainly, Catherine, I want to appreciate you and the Opioid Response Network for pushing the envelope in getting the voice of recovery out as well. At this point, we will open up to questions and answers. And I will direct to Julie Erickson if there's any questions that have been placed in the chat at this point.
Yeah, thanks, Michael, and thank you to all the panelists. You did a wonderful job. We do have a few questions. The first one is for Ryan. They're just asking if you could clarify what you said about recovery early on in your presentation. It was something like, it feels like it's not working, but then in September you see that it's working. Could you clarify?
Yeah, I think all of us wake up to just this crazy news cycle that we live in every single day. You know, sans today, which was some good news, Phil. I read that piece in NPR that things are getting worse. On the ground, I lost another friend of mine on Monday night. Haven't really had much time to process it. I think a lot of us who do this work get those calls every single day. And it oftentimes, when I say it feels like the work isn't working, you know, this is hard work, and we spend 12, 15 hours a day at it. And for many years now, it feels like the numbers have been going in the wrong direction. But then there are moments, you know, when you're truly connected to your community, and when you're able to get out of the box and off, you know, social media and turn off the news, you know, that you see things that are working. And I think it's important for anybody that does this work to realize that change also takes time, that this isn't going to be reversed overnight. It's not going to be reversed in 1 year, that we really have to play the long game here. So it's just a matter of remaining vigilant. And I see that vigilance and that resilience really on full display in September. And it's a profound, you know, sense of gratitude that I get from it. But it is hard work. I think my point in that was this is not easy work, and it doesn't feel like a celebration most of the time.
Thank you, Ryan. Our next question, I think, was during your presentation, Phil. They said the Native American Alaskan Native numbers are staggering. Is there a directed effort toward this population to educate and engage these communities?
So yes, there are more than one. And so at Black Faces, Black Voices, we are, that is not something that we are doing. And I actually had this conversation come up. We were doing a group last night in Pittsburgh, and this conversation came up. And someone said, well, why aren't you working on all the other groups? And that is there's a thing called whataboutism, right? And that's not what this request is, by the way. That is not what this is. But one thing that I know is that I have friends and partners in the Indigenous community that are working on this. They are the best qualified folks to work on this challenge. It's not for me to say, hey, here's a prescriptive solution to what needs to be done in the indigenous community. And I think it's really important that, because like we're in the numbers in the data that came out today, there are a couple of states that showed a decrease in Native or indigenous non-Hispanic numbers, right? So like it is up to people that are in that community and know what's best for that community to work on that. And I'm not saying it's not my problem. It's all of our problems. But I want to make sure that we're directing resources to the people in those communities to work on those problems, and not a sort of, you know, hand from above trying to reach in and fix that stuff.
Thank you, Phil. Any other panelists like to comment on that question? We wait for other questions to come through.
Yeah, I'd just like to make a note. Julie Erickson placed in the chat a feedback survey for today, and I would hope that all 108 of you would certainly take 2 minutes out of your 24 hours today and fill that survey out. But certainly, Julie, back to you. Thank you. Thank you, guys. Appreciate it.
Thanks for that reminder, Michael. Yeah, any other comments from the panel? I saw Catherine, sorry, you unmuted.
No, I was just saying, yes, please let us know, because if you're not getting what you need, then we need to know that so we can make change. I was brought up, if you don't know it's not working, you can't fix it. So please give us feedback. We always welcome it. And we're here to work with you, and just let us do something to make your work easier. Because like as Ryan said, it's not. And so that's why we have to come together, and together we can make a difference. And we are making differences.
Thank you, Catherine. There is another question that came through from someone also in long-term recovery. He asks, how do we get a lot of the recovery organizations to really be more person-centered? And I'll just open that up for anyone who'd like to respond.
In terms of person-centered, well, I'll just address from what I know. Person-centered it means a lot of different things. You have person-centered care, you have person-centered language. I honestly think it's through education. And I think sometimes there's also a nuance between recovery center and treatment centers. I would say more so with like authentic recovery, led community organizations. They've been pretty good on being at the forefront of person-centered language and person-centered care. I'd say that the treatment community could use a little bit of help with that, though, and it needs to be through education and training.
Yeah, I'll just add if I think about my time at recovery organizations, and I started at a very small one here in Minnesota. Show up. If you want to change, there. Show up and say, I want to change, and how can I help? And I know we would always put people to work. So I can't speak for the organization in general that you're referring to, or the organizations that you're referring to, but most of these places need foot soldiers. So if nothing else, show up and lean in, see if you can help, and then start talking about the things that you want to change.
Thank you both so much. And I think that's all the questions we have. Although we did just get one. And maybe if anyone has 30 seconds that they'd like to share a little bit about cultural humility and intersectionality. I know that's a big one to share in 30 seconds.
Yeah, have that and pay attention to that. That's my response to those two.
I think that's great for 30 seconds.
Hey, thank you, Phil. Thank you, everyone. I just want to share how important it is that the Opioid Response Network provides technical assistance and training. Certainly, Phil talked about equity dinners, how to help support and change within your community. Ryan is always mobilizing and advocating and providing education opportunity and services like the Mobilized Recovery Day of Service. So if you, like Phil said, if you want to be involved, find out how you can be supportive in these and other efforts and opportunities in your community. It's about how you can help make the difference. Thank you all for being part of this conversation. We appreciate your time and efforts in this work that we do. Be well and be safe. Thank you.